Hello and welcome everyone. I'm Nikki from the Massachusetts Health Connector, and I'm joined this evening by my colleague from MassHealth, Emily, as well as some other colleagues from the Health Connector. Emily and I will be presenting tonight's information. Together, we are here to share information about renewing MassHealth coverage or obtaining coverage through the Massachusetts Health Connector. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting tonight's webinar, including our partners in the state legislature and our congressional delegation. Before we get started into the presentation, there are just a couple of housekeeping items that we want to make sure you're all aware of. So everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, and then we'll have time for question and answers. If you'd like to ask a question at any time, please use the Q&A button at the bottom of your screen, and our colleagues are going to be monitoring your questions throughout. When you're entering information, when you're entering your questions, please do not share any personal information or private health information when you ask your question, as other colleagues may be able to see what you write. And if you have a personal scenario that you want to discuss with someone, we'll be providing contact information for both the MassHealth Customer Service Center as well as Health Connector Customer Service Center, as well as instructions on how to find help from a local assister. Now, we are recording tonight's webinar, so following this session, you'll receive an email with the presentation, so there's no need to take detailed notes. And at the end of the session, there will be plenty of time to ask questions. So again, we just want you to sit back, take all this information in, and we welcome your questions. So we are going to get started with the presentation. Emily, are you ready? I think we're ready. All right, so let's head into the overview. So as I said, both Emily and I are going to be presenting this information together. So just to level set, MassHealth needs to renew coverage for all members to make sure they're still eligible and receive the best benefit that they qualify for. So during this webinar, Emily is going to explain what members need to do to update their information and how to renew their MassHealth coverage. The reason we are co-hosting this session is that some people might find out that they don't qualify for MassHealth anymore. So we are here from the Health Connector to explain if someone still needs access to coverage, we'll explain how someone can get coverage, and they may get help paying for it through the Massachusetts Health Connector. So going on to the next slide, these are the items that we're going to step through. So Emily is going to explain what a MassHealth renewal is, discuss why renewals are especially important this upcoming year, and then she's going to share how you can prepare right now for MassHealth renewals. She'll talk about what you need to do if you get a renewal form in the mail. She'll tell you about resources available to you to help you complete your renewal. And then I'm going to step in and share a couple of slides on the Health Connector and more information about getting coverage through the Health Connector. So here, I'm going to hand this over to Emily because we thought it would be important to explain to all of you what the relationship is between MassHealth and the Health Connector so that you have context and can understand why we're providing this presentation together. So I will hand this over to Emily.
Thanks, Nikki. So first, a little overview about what MassHealth is. So MassHealth is Massachusetts state Medicaid and CHIP program. And so MassHealth provides health benefits and help paying for them for qualified children, families, seniors, and people with disabilities living in Massachusetts. And so right now, our total member population is around 2.3 million members who are residents of Massachusetts. So this represents about 2 in 3 low-income families, 1 in 4 Massachusetts residents, and 2 in 5 children of all income in the Commonwealth. And it's important to note that MassHealth covers services comparable to commercial health insurance, and additionally, services generally not covered by other health insurers, such as long-term services and supports and certain behavioral health services. So now I'll turn it back over to Nikki to explain the Health Connector.
Sure, thank you. So the Health Connector is the state's health insurance marketplace. So we are here to offer individuals, families, and small employers access to affordable health insurance coverage. So for those people who are transitioning from MassHealth, who don't get health insurance through their job or other sources, they can apply for coverage through the Health Connector. A lot of people who apply for help paying for that coverage may even be eligible for a $0 monthly premium payment. And then it's really important to know, because as Emily and I are talking this evening, we'll be talking a lot about health insurance coverage, but I really also want to acknowledge that the Health Connector does in fact sell dental coverage. So if someone is looking for that, they can also apply for dental through the Health Connector. Lastly, I just want to mention it, but it is not the focus of our presentation. Since we are the state's health insurance marketplace, we're here for individuals, families, and small businesses. So we have a separate kind of pathway for employers with less than 50 full-time employees, and that's through our Health Connector for Business program. But again, not why we're here this evening. If you are interested in Health Connector for Business, there is a webinar on July 12th. So with that, on to the next slide. So something both Emily and I will be discussing this evening is we'll be talking about this application, and we'll be talking about an application for individuals and families. So as part of our relationship, there is one application for MassHealth, the Health Connector, and Help Paying for Coverage. Now, this online application, as well as a paper application, Emily will explain that, but this particular online application that you're seeing on the screen right now is specifically for those people under 65 years of age. So as Emily is talking about, an online application, and I'm talking about making updates to your application, know that we share this system. So when a person is starting out and they are applying for coverage, they don't necessarily need to know, or they may not know what they qualify for. All they know is that they're looking for coverage. They want to see if they can qualify for some help paying for that coverage. So they can start at mahealthconnector.org. And if someone wants to complete the application or see the application in Spanish, you can see the link to the Spanish version of the application there as well. So going on to the next slide, I'm going to hand this back to Emily and have you go through your slides, your content. Thank you.
Thank you, Nikki. So we will jump into talking about what is a MassHealth renewal. And so a renewal is that the federal government requires MassHealth to regularly check our members to see if they're still eligible. And we call this check a renewal. Sometimes we refer to it as an annual review. And so these renewals need to occur every year. Generally, members get their renewal forms in the mail. And it's important to note that these renewals occur at the household level. And so the household is related to who is together in an annual tax filing. And so let's say a member is a parent on MassHealth, and they also have a child on MassHealth. The renewal, and they're in the same tax filing household, the renewal will come. There'll be one renewal that comes for both of those members, or all of the members in the household. Some members will be automatically renewed, where we match. When we select a member for renewal, the first thing we try to do is see if we can match their information against state and federal data sets. If we're able to do that, we can automatically process the member's renewal. No additional information or action is needed from that member if they are automatically renewed. However, if a member is not automatically renewed, then we send a renewal form in a big blue envelope in the mail, which requires action by a specified deadline. But we'll go into that in some more detail. So why are we talking about renewals this year in particular? So during the public health emergency that was associated with the COVID-19 pandemic, the federal government implemented something called continuous coverage requirements. And so in response to these requirements, we put protections in place that prevented MassHealth members from losing coverage. These protections were in place from February of 2020 through March of 2023. So what changed is that the federal government ended these continuous coverage requirements as of April 1st of this year, 2023. At that point, we returned to the standard annual eligibility renewal processes, which means all members will need to be renewed by MassHealth to ensure they still qualify for their current benefit. This is the first year in several years that members are at risk of losing coverage if they do not complete that annual renewal, or if they are found ineligible based on their response. And so it's important to note that while I mentioned that these continuous coverage requirements ended on April 1st, not all of these renewals are happening at once. They are taking place over a 12-month period from April of this year, 2023, through next year, April of 2024. And so it's important that members know that their renewal could come in the mail at any point during this 1-year period, and to continually look out for that blue envelope. So just want to make a note, as I said previously, whenever possible, MassHealth attempts to automatically process a renewal by matching data against state and federal data sets. There are some categories of members who may also be automatically renewed that I just want to highlight. So certain members who receive SSI through the Social Security Administration because they are 65 or older and have limited income. Certain members who receive SSI through Social Security Administration because they are disabled and have limited income. Certain members who receive temporary assistance of needy families. Certain members who are currently or formerly in the custody of Department of Children and Families or Department of Youth Services. Certain members in all these categories may be automatically renewed and not need to take action. However, if you do receive a blue envelope with a renewal notice in the mail, please respond to that notice within the deadline to ensure that you and the rest of your household maintain the best benefits you're eligible for. So as I mentioned previously, this year we are returning to standard eligibility rules. And so what that means is that updating your MassHealth account with new eligibility information, for example, if you tell us your income has changed, that may cause your benefits for your household to change, or they may stay the same. So they may stay the same, they may increase, decrease, or potentially end. However, we do want to note that generally you can call MassHealth at the number listed here and will be shared with the presentation to update your contact information without impacting your eligibility. And so what can you do now to prepare for these important renewals that are happening now and will continue to happen through April of 2024? The first is to call MassHealth to update your contact information. It is really important that MassHealth can reach members when it's their time for renewal. And so to update address, phone, or email, please call customer service to make sure that we have the most updated information so we can reach you with important items that need action from our members. The second thing that we want and encourage all members to do is read all mail that could be from MassHealth. We send important mailings that require action from our members. I've mentioned this large blue envelope that has renewal notices in it, but there's also other important mail that comes from MassHealth that is typically in white envelopes that require action to ensure that members can keep the best benefits they're eligible for. And so this is the big blue envelope that I keep mentioning, a picture of it. So if you or members you know see this envelope, please note what the action it is asking for and respond by the deadline listed in the envelope. And I'll go into a little bit of how to complete the renewal once you receive the envelope. So that's right here. And so, you know, as there are different renewal options, different options to complete the renewal for members who are under 65 compared to members who are over 65. So I'm just going to take one group versus the other. And I should note, sorry, it's not just members over 65, it's members over 65 and also members of any age who are receiving nursing facility care or in one of our HCBS waiver programs. But first, let's start on the left-hand side, actually, for options to complete renewal for most members under 65 years old. So the easiest way is to go to the website here, mahicks.org/individual, and complete the renewal and provide the information through the login there. Members, though, also have the option to complete a paper renewal form and mail it into us or fax it into us at the number listed here. If you need assistance or would like to complete a renewal over the phone, you can call our customer service center. We also have MassHealth representatives who can help with renewal related questions, and I encourage folks to schedule an appointment with those representatives via the link listed here. Okay, turning to the right side of the page, so options for most members who are over 65 years old or of any age receiving nursing facility or long-term supports and services or are in one of our HCBS waiver programs. For this population, there's a e-submission option, which is a upload or a upload option. On the renewal form that you receive in the mail, there'll be a submission number, which can be entered into the website here, and then a document can be uploaded or you can fill out a fillable form there. Members in this category also have the option to mail in their renewal form or fax it in. They also have the option to complete the renewal form over the phone by calling customer service and have access to the same appointment scheduling system and access to get help from MassHealth representatives. In all of the renewals, there'll be a deadline listed for response, which members should note and reply to MassHealth by that deadline. However, if you miss the deadline, please reach out to MassHealth via our customer service number as soon as you realize, so that we can ensure that you continue to receive the best benefits you're eligible for and minimize any gaps in coverage. So just want to highlight some resources that members can use to get help completing their renewals. So I want to just highlight three. The first is our MassHealth enrollment centers. And these centers provide a variety of types of assistance, including phone, virtual, and in person by MassHealth staff members. And so we encourage you to schedule an appointment to speak to one of these staff members and get help. And I will note there are 6 MECs across the state. And so you can go online to find the nearest one to you. The second resource I'll highlight is the certified application counselors and navigators. These are community-based resources to help members apply for and renew health insurance benefits. They are trained by MassHealth, but are not MassHealth employees. And their services are always free, but may require an appointment. And you can find the list of certified application counselors and navigators on the website listed here. The last resource I will highlight is our MassHealth Customer Service Center, which can be reached at the phone number here. Our service center has access to a language line, which can provide translation into almost any language a member may need if they need assistance in a non-English language. So just want to go over some of the timelines associated with the renewal process. First, if a member is selected for renewal, the first thing that MassHealth does is we see if we can automatically process that renewal by matching information against state and federal data sets. If we can automatically renew a member, no further action is needed by that member. If we cannot automatically renew or process that member, we send a renewal notice in that big blue envelope that I shared a picture of. Members, once they receive that notice, typically have 45 days to respond to that renewal notice. I will note that here it says for members in long-term care facilities, they have 30 days. We've actually updated that to match other member populations, and they will also have 45 days to respond. I will note that those notices have a due date, so just make sure to look out for that. It should align with this timeline. Now, if a member responds to our renewal notice and we determine, and MassHealth determines that we still need more information to process that renewal, we send the member what's called a request for information. They will then have 90 days to respond to that request for information. Now, let's say a member responds and is determined that they are no longer eligible for MassHealth, or they do not respond and are end up being having their coverage terminated. We send the members a notice that at least 14 days we send members a notice that gives them 14 days notice before their benefits stop, so that they are aware that end date is coming. Now, for members who are terminated because they do not respond to their renewal notice, we have something called a reconsideration period. And so for those members who are closed or have their coverage terminated because they do not respond to a renewal notice, they can reach out to MassHealth by calling our customer service center. And if they provide the necessary information to complete their renewal and are determined eligible based on that information, we will backdate their coverage back to the date of termination. However, they need to reach out in 90 days from having their coverage end to have that coverage backdated back to the date of closure. Of course, if a member realizes they missed their they failed to respond and they were terminated, but it's after that 90-day window, they can still reapply to MassHealth coverage and can get MassHealth coverage. It just won't be necessarily backdated back to the original date of closure. And so just want to note that, I've been talking a lot about the blue envelope and when members are selected for renewal, but members do have the option to complete their renewal before receiving a blue envelope. I do want to note that if a member initiates their redetermination by providing updated eligibility information, their coverage may change. It may increase, decrease, or end, or it could stay the same. So they should be aware of that. And MassHealth, just to note, separately from changing, providing updated eligibility information, most members can update their contact information without impacting their eligibility by calling MassHealth, and we highly encourage members to ensure that we have the most updated address and contact information so we can reach them with important mailings and notices. I do want to note that we have a number of language and translation supports. First, we've developed some member-facing materials, including flyers and posters and key messages around this renewal process, and they are available in 9 languages listed here. and encourage you all to go online. I'll share the link in a few slides to find those materials. We are also publishing some vlogs, and for certain of our webinars have ASL translations for members who use ASL. Members can also receive the renewal forms in English, Spanish, or large printer Braille upon request, and can have translation services via our customer service center. Again, there's a translation line that can translate into almost any language a member may need. We know that some members will be determined ineligible for MassHealth, and want to note that if you are no longer qualified for MassHealth, there are other affordable coverage options. I will not go too much into the Health Connector option since they will dive into that in a few slides. But for members over 65, want to note that individuals that losing MassHealth qualifies for a special enrollment period for Medicare, and that members who lose coverage may qualify for Medicare Shared Savings Program. I do want to note that we really encourage members, even if they think they're no longer eligible for MassHealth, to complete their renewal form, because this may help determine other affordable healthcare options like the Health Connector, or sometimes there are households where a parent may no longer be eligible, but their child is still eligible. So we encourage all folks who receive renewal forms to complete them. We have some helpful materials on our website, including this MassHealth Renewal Help Guide that has screenshots and step-by-step instructions to creating an MA login account for members under 65, or how to use that e-submission option for members over 65. It also lists a number of resources to get help with renewal forms and process, and lists some frequently asked questions. So this is a great resource to learn more information. We also want to direct you to our renewal website. The flyers and posters that I mentioned earlier can be found here, along with that help guide and other helpful materials on how to complete renewals and how to spread the word about this renewal cycle. Just some final tips before turning it back over to our colleagues at the Connector. If you are under 65, the fastest way to renew is online using your MA login account. If you're over 65 or in a nursing facility or HCBS waiver program, this website, mass.gov/masshealth-SACA, is the best way to find information about renewing your coverage. I'll encourage you again to call MassHealth to update your contact information and address. We do want to note that sometimes due to high demand, members may experience longer than usual customer service hold times, but there are some self-service options when members call in to hear about documents that may be outstanding or other helpful information without having to speak to a representative. Again, please be on the lookout for a large blue envelope and any other mail and white envelopes that may be from MassHealth, especially in this period from now until April of 2024. And please use one of the many resources available to help you complete renewals. We know that for many members, it can be a confusing process. And so these resources can help support members to ensure that they can keep the best benefits they're eligible for. So now I will turn it back over to Nikki to go through some content on the Health Connector.
Thanks, Emily, and thank you everyone for staying on. So I want to just talk a little bit about qualifying to enroll in Health Connector coverage. So Emily touched on this a little bit, and I've described it a little bit. But if someone loses access to MassHealth coverage, it's what in the health insurance world is considered a qualifying life event. And that in and of itself allows someone a special enrollment period. Now, typically with special enrollment periods, that lets somebody either enroll in coverage or change health insurance plans outside an open enrollment period. So for those of you who are familiar with private insurance, I think some of these terms are going to sound familiar to you. But for those of you who are not, don't worry. Essentially, it just means that sometimes things happen, and that means sometimes things happen in our lives, and it means that because of those changes, you don't have to wait till a particular time of year to enroll in health insurance coverage. So let's say your household size changes, let's say your income goes up or down, your immigration status changes, or you move from one part of Massachusetts to another part of Massachusetts where, you know, the coverage that you were in is no longer available. These are the types of things, as well as some of the other items listed, like getting married, having a baby, or even losing job-based health insurance. These are the types of things that will let you have a qualifying life event special enrollment period. Now, when something like this happens, we really just encourage people to report this as soon as possible. So if you do have an application with MassHealth or the Health Connector, you want to update us, let us know, report that change. And let's say you're newly coming to MassHealth or the Health Connector, you want to just pay close attention and try to get to us as soon as possible. Now, as you're going through the health insurance enrollment process, some people will need to make a payment in order to enroll into coverage. So while you're going through that process, if there are any payments due, or we have enrollment deadlines, and I'll talk about those, all of that still applies during the special open enrollment period. Basically, this lets you get into coverage. These types of events let you get into coverage. On to the next slide. I want to talk a little bit about where somebody might get health insurance coverage. So both Emily and I have said, you know, if someone is renewing their MassHealth coverage, it might be that find out they're no longer eligible for MassHealth. There are going to be some people who might be eligible for health insurance through a job, through their employer, or through an employer of their spouse or partner. So if you're not sure and you're curious to see whether or not you could be eligible for benefits through the employer, the employee should reach out to Human Resources or to the Benefits Department to find out a couple of things. One, are you eligible for benefits for yourself or for the family? Two, what is the cost of those plans? How much will you, as the employee, or how much does the employee need to contribute? And lastly, when do you need to make a final decision by to enroll in that employer-sponsored health insurance? Now, really, really important to note is people with access to affordable coverage through an employer are not eligible for financial help through the Massachusetts Health Connector. So as a person who you might be thinking, okay, what if this doesn't seem affordable to me, right? You are going to the employer's coverage and you're looking at it and you're like, I don't know if this is going to work for me or my family. So please note that, like, if you're in that situation, plans and savings could still be available to you. And all of that is going to be based on the state's affordability standards. So what we would encourage you to do is gather detailed information about the plans that are being offered by the employer. And then as you're going through either the online application, the paper application, you're going to be asked some very detailed questions that truthfully nobody would know offhand. You really need to get this detailed information from the employer. When you get the slide presentation, you can click on this link and it's going to bring you to a worksheet and you'll see all of the questions that you're going to want. You're going to need some help from the employer and they can provide that to you. On the next slide, I think we're also here talking about moving forward, right? So let's say you're like, nope, that's not me. I don't have an employer offered, I don't have insurance offered through an employer. I can't get that through my partner. So why should I come to the Health Connector? So a couple of the things are really important here. First, all the plans sold through the Health Connector meet both state and federal standards for coverage. So these are all what are known as qualified health plans. They're comprehensive. And by coming to the Health Connector for coverage, you're going to be able to choose from a variety of plans in your area from leading insurance companies throughout Massachusetts. So depending on where you live, you're going to have different options. Now, exclusive to the Health Connector, because we are the state's health insurance marketplace, some people may qualify for tax credits that let them reduce the cost of their monthly premiums. And then other people who are in lower income ranges and meet other eligibility requirements could find out they qualify for a low or no cost monthly premium health insurance plan. So really, these are very good reasons to come to the Health Connector for your coverage. So going on to the next slide, I want to talk a little bit more about what this really all means. You have these subsidies. These are what are known as federal subsidies through advanced premium tax credits that help you pay for monthly premiums. And if somebody finds out they're not eligible for the Connector Care program, you could still be, in fact, eligible for advanced premium tax credits. So there is a chart on this slide, and it's just showing you, some what the lowest cost premiums are by plan type. So maybe what's really, really important to note here for someone who's watching this, listening to this, is that, when you complete your application, if you find out that you're eligible for a Health Connector plan, you may also find out that you're eligible for a Connector Care plan. And there are going to be different plan types based on your household income. So again, you might find wow, we're in the lower range here, so it's $0. Or I'm eligible for a plan type 3B. My income's a little higher here, but I could get something for as low as $137 a month. Now, going on to the next slide, I want to be thoughtful of time here because I know there are a number of questions that people have asked, so I'll try to move through these a little bit quicker. Emily talked about different ways to update your application. I just want to reinforce that. If you are under 65 years of age, you can go to mahealthconnector.org or go to the Spanish version of the application, which is mahealthconnector.org/ES. You can also get help over the phone or with the help of a community partner organization or health center. So Emily talked about going to a navigator, going to a certified application counselor. Remember, there's one application to find out if you're under 65, there's one application to find out if you qualify for coverage through the Health Connector, including help paying for coverage or for coverage through MassHealth, which again is our state's Medicaid program. Because we share an application, you are going to get letters from both the Health Connector and MassHealth. So legally, we're required to do that. So apologies in advance, but we just want to explain what that's all about. Onto the next slide. A lot of this is, again, reinforcing what Emily has shared. There is a lot of free help available. Emily shared information about the MassHealth Customer Service Center. The Health Connector also has a dedicated customer service center. The number is listed on this slide as well as on our website. One thing I forgot to mention, or I don't think I've mentioned yet, is that in addition to going to customer service or reaching out to a community partner, there are also going to be a series of local events that will be taking place over the summer. So again, when you get this presentation, if you would prefer to go in person to a local event, you can click to see if something's happening near you, and you can actually go to that event as well. If not, and you really want to meet with someone face-to-face, we highly recommend that you call ahead to schedule an appointment. And the link to finding local help is the same link that Emily talked about. And you can, in fact, go there, search for someone near you, and even search for a particular language if you need support in a language other than English. On to the next slide. For the Health Connector, there are a couple of key takeaways that I want to leave you with. So if, again, for people who have lost access to MassHealth coverage and still need health or dental coverage, you can come to the Health Connector to enroll. Really important to update your application to find out what plans you may qualify for and if additional savings are available to you and your family. Remember, the Health Connector offers coverage for individuals, families, and small employers. And the Health Connector has a set of deadlines, which I don't think I shared before, but just to note, all of our coverage begins on the first day of each month. So somebody needs to apply, enroll, and pay their first premium by the 23rd of the month before coverage can start. So as an example, if you were looking or needed coverage for July 1, you need to take all of your action by June 23rd, and then your coverage could be effective by July 1. So please, if you need assistance, take some action and get, there are lots of different ways that you can get assistance. So I think at this point, we are going to move on to questions. So I'm just going to pause for one moment while we switch gears a little bit.
So one question we got is someone is experiencing getting a number of mailings in white envelopes, some potentially saying that their coverage is expiring, but are concerned they have not received a blue envelope. I would say if this applies to you or a member that you are working with, please call the MassHealth Customer Service Center to work out what the action is needed and clarify what you need to do to ensure that you continue to receive the best benefits you're eligible for. I know sometimes these mailings can be confusing, but our customer service representatives can help clarify the action needed. I think there's another question about getting language help. I think on the MassHealth side, the fastest way is to call our customer service line, who can connect to a interpreter line that can bring somebody on who speaks just about any language a member may need, and they can kind of in real time help translate forms received or provide assistance in another language. But Nikki, from your end, anything to add?
Yeah, just that similar to you. If someone calls customer service, they may Health Connector customer service. Some of our staff are able to talk with you in a different language. You just need to ask. And then, just like Emily described, if it's a language that there aren't any representatives that speak that language, they can, in fact, connect everyone to this translation center and get help. There's another part I feel like about getting help in, getting help in your language. And I know people, there are certain notices that come in a preferred language. So if somebody is getting a letter or notice in a language other than what they requested, I would suggest that they also let customer service know so that any language preferences can be updated. So I think those are the only things I would add there.
I think the next one would maybe be helpful, Nikki, for you to weigh in on. I believe this question is about if someone loses MassHealth coverage, do they need to prove that coverage loss to qualify for the special enrollment period through the connector?
Yep. Thanks, Emily. As I was looking at that question, I was thinking, okay, how does this work practically? So if someone has MassHealth coverage right now, or let's say somebody was protected in MassHealth coverage, and they no longer qualify for MassHealth, what should happen in the online application is once you update it, if in fact you qualify for Health Connector coverage, you will see that that you do. It's going to be showing as an eligibility result. So you do not have to prove a loss of MassHealth coverage. Now, if like on the connector side, let's just say the person wasn't coming from MassHealth, they just they're being asked to prove a loss of coverage. Sometimes a person sees a set of questions, we call it, loss of coverage questionnaire. So you don't even need to worry about it. It's just, you see some questions like, how did you lose coverage? If in fact you need to prove that, let's say you had employer-sponsored insurance that ended, you would actually get, and Emily, I think you talked about this a little bit, a notice that says, we're requesting more information from you. So when you get to the end of the application, if somebody under 65 needs to prove any loss of coverage, you'll be able to see those notices and that request in the application, and people will also be mailed a notice that explains that they need to provide some proof back to the Commonwealth. And then Emily, I think I can take part of this next question. Maybe I can answer it from the Health Connector side, and then maybe if you want to add anything from the MassHealth side, because I don't know if it's that imperative for you folks on the MassHealth side. We have a question about tax filing, and it says, what do I need to know if I don't file taxes? I think the important thing is that some individuals aren't used to filing taxes because they're in a lower income range and they don't need to file taxes. We work with a lot of volunteer tax professionals who tell us, no, it's really good for people to file taxes, even if they typically don't need to, because there could be some tax credits that they could be eligible for, like some earned income tax credits. So you might want to consult with a VITA or a free tax preparation clinic. Now, specific to the Health Connector, the reason it's important for someone to file taxes is because if you receive savings through the Health Connector, so let's say you receive advanced premium tax credits or you find out you qualify for connector care, the way in which those savings come to you are in the form of tax credits. So if you're determined eligible for these tax credits, the money that you're eligible for goes directly to the health insurance carrier. You, as the consumer, just see a lower monthly premium. But as you're going through the online application, where you're being asked to confirm that you're comfortable committing to filing and reconciling your taxes each year. So that's how tax filing is associated with the Health Connector. Emily, I don't necessarily think that applies on the MassHealth side.
Yeah, I would say filing taxes is not, a requirement to qualify for MassHealth. I would say complete the renewal or application forms, and your eligibility will be determined based on those. And if we need additional information related to your income or assets, we will ask for those and send you a notice about those.
Okay, great. And then the next question is, it's sounding like some technical issues with the online application. The person saying they are seeing red asterisks near name, address, birth date, etc. So where can this person go and get help? So I guess I just want to say you can get help either from MassHealth customer service, Health Connector customer service. If you give our customer service center agents permission to access your account, they can work through all of these questions with you. So they can help you pass through all of those fields. Emily, is there anything you might want to add?
No, I'd just say call to get some help from our contact center.
Okay, great. And this next question, I think, is for you on your side related to estate recovery. Can you talk a little bit about that?
Yeah, so the federal government requires that MassHealth participate in estate recovery for certain of our members. This applies to certain members in certain scenarios. And so I think the best way to learn more, if you have questions about estate recovery and how it might apply to you as a MassHealth member, is to call our customer service line and ask about your specific scenario.
Okay, great. And it looks like we also have a question about losing access, well, turning 26 and losing access to a parent's employer's, their employer-sponsored insurance or parents coverage. And for that person or people who are wondering about that, if you are turning 26, that is a qualifying life event, and you can certainly come to the you go to the online application at mahealthconnector.org. And you will see that questionnaire, and you basically have a special enrollment period because of that reason. You are turning 26 and you would need coverage for yourself on your own. And I just want to check, did we have any additional questions that we did not? Yes, we have some additional questions. Okay. So it looks like we have a question about applying for coverage. Someone claiming the person as a dependent, do I need to share information about the whole family? So what I will say here, and Emily, feel free to add in from a MassHealth perspective, is the Health Connector looks at the person's tax filing household. So we are interested in knowing, we're interested in knowing about that whole tax filing household, because even if someone in that household isn't applying for coverage, we're trying to look at the whole composition of that family so that we can figure out the best coverage available for you. And Emily, I think you mentioned this before. Sometimes when somebody applies or somebody renews, they could be in what we call a mixed household, which essentially just means that some people in the family are on MassHealth while others in the family are eligible for Health Connector coverage.
I think you perfectly summed it up, Nikki.
Okay, we have a few more questions. Let's try to get through. Someone is asking about being self-employed with varying income. And I think what I would suggest here, they were asking, how should I manage updating my income? And again, how to get help. So in terms of updating income, you're asked about income in two ways. When someone's going through the online application, they're asked about current income. And then they're also asked about their expected income for the year. So it's really important that someone estimates their income for the entire year as best as possible. And if that income goes up or down throughout the rest of the year, you can on your own go back into the online application and and make adjustments, or contact customer service, either MassHealth or the Health Connector, and you can ask them to make adjustments. You can also go to a local assister and they can make adjustments to your application with your permission and your direction. Okay, so there's a couple more here. One is from a mother that has a dependent, and she was wondering if the cost of the plan that they were eligible for was per person or per household. And again, it really is going to matter what that, the age of your dependent, etc. It may be that the adult in the family, you as the adult, could be eligible for a Health Connector plan. When you see that monthly premium, that if you're getting subsidies or you're getting savings with that plan, you are getting that savings as an individual. However, there are Health Connector plans where you can simply buy a family plan, and that is the cost for the entire family. Or there may be situations where mom is on a Health Connector plan and child is on MassHealth. And Emily, I feel like there are a few more here for you if you want to take a couple.
Sure. There was a question about MassHealth, Common Health.
Yes.
So we have a number of different types of benefits, and Common Health offers healthcare benefits similar to our MassHealth standard, but is for members who are adults with a disability and members who are children with a disability. There are specific kind of eligibility criteria, which are a little detailed. So I would recommend there are some online materials on our website explaining who gets the benefits and some of the covered services and income standards. Again, if you're more comfortable speaking to a representative, our customer service can also explain the criteria and the benefits of that program. Let's see.
Emily, would it be okay if we jump to the question about the person who said they had MassHealth or Health Connector before, asking about, is their information going to be saved in the system somewhere when they apply again, and can they log into the same account? I feel like that's relevant for both of our purposes, in that if someone had applied before, we definitely want them to log into their old account and just update their information, right?
Yes.
Because yes, I'm sorry, I didn't mean to. And I'm saying it that way because if you try to create a new account, it might actually cause people problems. So if they're having any difficulty, you should certainly reach out to customer service and they can help.
Yeah, and customer service will be able to see that history. Even if you were, let's say, your coverage terminated, there'll be a kind of the record, and they'll see what information needs to be provided, and help you with the next steps to make sure you can reapply and get back on the best benefits you're eligible for.
Okay. And then another one that I definitely wanted to get to is, what if I don't have a residential address? What do I put into my account? And I know that, I don't know if Emily, do you know, or if I can call on one of our other colleagues to help with that question? I think there is a way of saying I don't have, like there's some, if someone's homeless, let's say, they can indicate that on the application, right? Someone must provide a mailing address. Someone needs to live in Massachusetts in order to receive these benefits through either MassHealth or the Health Connector. Is there anything else we need to add to that?
That is my understanding as well.
Okay. Great. Okay. We have a couple more, and I'm sorry if I jumped around a little bit. I think we've already discussed subsidies and advanced premium tax credits and how they work. But I can talk about that for, well, actually, let me do this first for Health Connector coverage. In terms of explaining when somebody needs to pay and like the start date, I think it's important to just note a difference between Health Connector and MassHealth coverage, in that Health Connector coverage starts on the first day of each month. So someone, when they're getting ready to enroll in that coverage, or they want to enroll in that coverage, the deadlines are always the 23rd of the month, and coverage always starts the first day of the following month. Emily, I know you have different rules on MassHealth side if somebody in fact finds out they qualify for MassHealth coverage.
Yeah, if there's a few different rules about when coverage will start. It's based on, it's not kind of the same cadence that for all members. It's based on when they're submitted they were determined eligible, and then will be given coverage based on that. Okay, generally great. With a little bit of retroactive coverage.
Okay, great. So it's basically a little buffer. I think the point I wanted to drive home for people is that MassHealth coverage doesn't always start on the first day of the month. but Health Connector coverage does. So that is a big difference for people who might be transitioning from MassHealth over to us. And folks, I know we're just after 7 and we want to be respectful of your time, but we do see a lot of participants still on. I don't know if there are any other questions that we missed or did not get to cover. Emily, do you see anything else coming in that we didn't get to?
I think that we've covered most things, and you know, sorry for the folks who might have had a question we couldn't get to. But it always seems like there's more questions than there is time.
Yes, but you know what? We mentioned that we send a follow-up email. So just give us about 24 hours. You will get an email. Anyone who registered for the session will get an email. They'll get a copy of the presentation. And if there are any questions that we didn't get to, we'll provide links and information to those questions. So no need to worry. And we are so grateful that you joined us tonight and you stayed on with us to go through the presentation and the questions. So thank you all so much. And Emily, I'll give it to you.
Thank you all for coming tonight. Appreciate it.
Thank you. And thanks everyone for all your help on the back end. We really appreciate it. Take care.